Hey, this is Dr. John Mark Chesney, a licensed physical therapist and owner of Simply Physio and the Pickleball Physio. And I saw a question recently about a pickleball player who was dealing with a small rotator cuff tear, who said that their physical therapist told them that electrical stimulation does not help with healing their injury. And there was a question of if this was true or not. And I just wanted to speak to that, just my understanding and skill set in working in this field. And first of all, what is electrical stimulation? So, if anybody's had physical therapy experience, oftentimes you'll end your session with some sort of electrical stimulation, usually combined with heat. So electrical stimulation, you're going to have electrodes, usually 4, sometimes 2 electrodes placed around your area of pain. And then a hot pack is usually placed over that area. And then the intensity is turned up to a comfortable level. Where in essence you'll receive, it's almost like an electrical massage. Kind of needs the area. If you're in an active state of pain, just the electrical stimulation can distract the nervous system from sending the pain signals. So instead, you feel the electrical massage, so it can give you some temporary relief in pain. Now, most people, even if you're not in a state of pain, it's a relaxing part of the treatment. It just kind of feels good. The long-term benefit is really not supported by evidence. When they're looking at long-term outcomes, people that receive some form of electrical stimulation really show no further benefit in long-term outcomes besides just the short-term relief. May just last the time that you have the treatment. Some people can receive some continued benefit for maybe a few more minutes, maybe at most an hour or two after that. But for most people, it's just an extra feel-good piece. That plays no significant impact on their recovery and outcomes. The other technology that oftentimes people would receive would be ultrasound. So ultrasound use ultrasonic sound waves to provide typically a deeper heating sensation to an area of injury. And very similar to electrical stimulation, for most studies, there's really little evidence to support long-term benefits or that ultrasound aids in somebody's outcomes or makes a significant impact in somebody achieving a level of success. Some form of deep heat, can have potentially some therapeutic value, where a deeper heat could help improve circulation in an area, help improve blood flow, to maybe help improve some injured state. But again, this isn't strongly supported by evidence. In our clinic here at Simply Physio, we actually don't even own either the electrical stimulation or the ultrasound, because most of our clients, when they understand that this is not a vital piece of their recovery, that they'd rather just get on with their day and shorten their session so that they can get what they need and get on with the rest of the things that they have to do. So we don't even utilize or own both those interventions for our cases of how we really value and prioritize the more important things of helping somebody recover from an injury. So a small rotator cuff tear is something that usually is not going to need any type of substantial surgery or anything like that. And it's more along the lines of getting the rotator cuff that is intact, which is the majority of it, strengthened, and the right type of combination of posture and alignment of the spine, movement around the thoracic spine, the shoulder blade, or the scapula, and making sure just the joint in the shoulder is in the correct position during movement. And when this happens, the body's able to typically recover when you're working alongside just a skilled physical therapist to help guide you in that process. So hope that helps to just answer some questions about common physical therapy interventions in regards to rotator cuff tear type injury. Thanks.